because my mom was only diagnosed or just diagnosed breast cancer 2 years before me. Yeah, so very simple. I thought, okay, so if this was not something good, immediately I went to see the same breast surgeon to confirm. But even before that, during the ultrasound, I was already told by the imaging specialist saying that it's not good. When she put the probe on my breast and saw the lesion, she already said, sorry, I have to tell you it doesn't look good. So to me, I didn't really have to wait for biopsy, but I already started to feel the emotion, being very sad because my daughter was just 8 months old. Yeah, so I started to think about my daughter, who would take care of her. How about my business? I was just starting a new business at that time. The same week I got diagnosed. Yeah. So being a medical doctor, I think I allow the whole process to be very fast, because on the same day I did my ultrasound mammogram, saw the breast surgeon, arranged for biopsy in 3 days, and then had my staging scans in 7 days, and diagnosis was confirmed right after that, and started my chemo on day 11. So my advice is, if anybody finds anything unusual on the body, any lumps especially, be fast, be quick. So nowadays, if I have any friends or colleagues that have found something on the body, I would tell them to do any test on the same day.
I think this question I want to ask both Dr. Amelia and Dr. Aiesha, because there are some patients, probably when they first get the diagnosis, they want to seek a second opinion. Is it advisable for them to seek a second opinion, or should they start on their cancer treatment as soon as possible?
So in terms of cancer treatment, there is a sense of urgency. So we want to get the diagnosis as quick as possible. If it's malignant, we want to get rid of the cancer as quick as possible. So in my case, when I had my cancer, I do not go for hunting. So meaning the surgical aspect need to be done fast. But I understand, depends on your staging. If your staging is pretty early, like for me as a triple negative breast cancer patient, let's say if I wait for my treatment, surgical treatment, it will be quite risky because the nature of the triple negative breast cancer is aggressive. So the longer I wait, the higher chances for it to be metastasized. So do not wait. Get rid of the cancer as quick as you can, and then for the chemotherapy, radiotherapy will be according to the plan. You can see other doctors for the treatment. And another aspect, if let's say you need a treatment plan in terms of surgery that involve aesthetic thing. If someone who are like young patient and they opt for mastectomy, you can delay it, like in the future, maybe you want to consider doing an implant. So please tell the doctor in advance so that they can leave some skin behind, So if it's completely flat, then there's no place to put the implant already. So this is something doctor need to highlight, because cancer is a story. Cancer patient has a story and their life is evolving. So maybe today, I do not want implant, but maybe how about tomorrow, And let's say you are doing mastectomy and then maybe you want to have like the flap. So bear in mind, people who want to do activity like sports, like bodybuilding, so it's not possible, to take latissimus dorsi and take it to use it as a flap, because it will affect your balance, symmetry. So there's a lot of pros and cons, and this is beyond textbook. So that's why I really advocate patients to really make sure that they know what they want, what they can accept, and what they can't accept. But at the same time, do not delay your treatment. The longer you wait, the higher chances for it to metastasize. So this is the most important thing, especially when you are young. Young individuals have higher rates of getting an aggressive type of breast cancer. So both of us are triple negative breast cancer, and when I went through all the research paper at that time, which is not recent, the statistic on our longevity is pretty gloomy. Yeah. So I'm happy that I did the right thing. So I'm here right now because I did the right thing in the beginning, and I had an amazing doctors who helped me throughout my journey as a cancer patient. So thank you to all my doctors.
Dr. Amelia, do you share the same opinion, or do you have anything else to add?
I think being a doctor, we can answer easily that we don't need second opinion because we already know what's happening. But it's very normal for laymen or normal people to want to seek for second opinion. For me, I think it's okay, provided the time taken will be very short. For example, my case, I sought for 4 opinions, not for my diagnosis, but for my chemotherapy plan, because triple negative has got a lot of advancement medically and got new plans out there. So I think the take-home message is, like what Dr. Aiesha said, I strongly agree. Do not wait for the treatment plan to start. Can start first, then only ask for more opinion for further the treatment plans. For my case, I actually spent like 1-2 days to complete my 4 opinions from different doctors. Even I did a Zoom with a professor from Singapore to discuss about my plan. So it can happen in very short time if we know what to do.